Nigeria, before now, has enjoyed about 95% of funding of the HIV/AIDS virus from international agencies. In this special report, correspondent Glory Kiba reveals that with the reduction of donor funds on HIV/AIDS by major donors, experts say government at all levels must come together to chart ways of bridging the gap in the treatment of the virus in the country, especially with the rising number of carriers.
It is no longer news that 95% of HIV and AIDS funding in Nigeria is largely provided by international donor agencies. The 95% HIV and AIDS funding for about 1.1 million Nigerians on treatment came from the United States government and Global Fund. But in recent times, the United States of America and other major donors to HIV/AIDS programs in Africa have reduced its funding for antiretroviral drugs and research. The priorities to funding innovation in global health has hit an all-time low in the annual investment for HIV prevention, research and development as major donors have reduced their support. Experts say if Nigeria must meet the target 90-90-90 by 2020, then it must look within and ensure that government at all levels dedicate resources to deliberately fund HIV/AIDS in the country.
Donor spending is decreasing, and therefore it's very important for the local resources. At least the federal government has put some resources into HIV funding. When it comes to state and LG level, it hasn't been commensurate. So it's important that at least the state and LG put some amount of money into the HIV/AIDS response. And also the federal government, we're hoping that they can increase the allocation and release of the money for HIV interventions in the country.
Local government chairman, Minister of Health, Commissioner for Health, school inspector, health visitor, community health worker, do something in your area of domain, but that adds and aggregates to total health coverage for everybody, so that we can have better livelihoods, better health, and that the objectives we fix for ourselves in the SDGs about good livelihood, good health will be attained.
Nigeria has the second largest HIV epidemic in the world, although HIV prevalence among adults is much less than 2.8% than other sub-Saharan African countries such as South Africa, which has 18.8%, and Zambia 11.5%. And with the size of Nigeria's population, this means that 3.1 million people were living with HIV in 2017. It is also estimated that two-thirds of new HIV infections in West and Central Africa in 2017 occurred in Nigeria. And this is despite achieving a 5% reduction in new infections between 2010 and 2017. 6 states in Nigeria account for 41% of people living with HIV, including Kaduna, Akwa Ibom, Benue, Lagos, Oyo, and Kano. And the federal government is not resting on its oars in ensuring that states and local governments pool resources together to fight this menace.
It's a collective effort of the national and the state governments. The national will be responsible for the overall coordination of this activity and be able to develop platforms where people come together to discuss efforts so far on this program. And they will also ensure that all the plans and activity that at the national level are replicated where? At the state level. And we also liaise with the supply chain management to ensure that there is continuous availability of HIV/AIDS commodity.
Easy access to antiretroviral drugs will also encourage more Nigerians to test to know their status, knowing that treatment is available. As a call for more funding for HIV/AIDS treatment is made, experts advocate more enlightenment campaign to halt the spread of the disease through unprotected sex and other means. Glory Kiba, Code TV News, Abuja.